In metatarsus adductus, the forefoot is adducted at the tarsometatarsal joint. It may be caused by intrauterine molding and may be perpetuated by sleeping prone.
Assessment. On examination of the foot, the sole has a convex lateral border and a concave medial side which is passively correctable. The hindfoot is normal or in slight valgus.
Measure the heel bisector line. Flex the knee to 90 degrees and dorsiflex the ankle so that the plantar surface is parallel to the ceiling. Approximate a visual line parallel to the heel and extend distally to the toes. A normal heel bisector line goes through the second toe. Metatarsus adductus is diagnosed when the heel bisector line is lateral to the second toe. Flexibility of metatarsus adductus should also be assessed by applying lateral force to the great toe and attempting to reduce the heel bisector line back to the second toe. Management. If flexible, 90% resolves spontaneously by 3 years old. Referral is warranted if the deformity persists at 3 years old, if there is stiffness, asymmetry, pain, or calluses. Tibial torsion. In tibial torsion, the tibia usually internally rotates, producing in-toeing. The exact etiology is unknown, but it may be due to intrauterine positioning or excessive tightness of the medial ligamentous structures of the leg.
Assessment. It is commonly noticed when the child begins walking and parents report that the child's legs are turning in or they have new onset clumsiness and often trip.
Femoral version. Femoral version is the angular difference between the longitudinal axis of the femoral neck and the transcondylar axis of the femur in the horizontal plane. Increased femoral anteversion is associated with increased internal rotation and decreased external rotation of the hip. Increased femoral anteversion is the result of intrauterine molding and genetic inheritance. There is a wide variation of normal. Assessment. On examination, the patella face medially when standing. During gait, there is an internal foot progression angle and an internal patella progression angle. There is an egg beater pattern during running and preference for sitting in the W position. Management. Both tibial and femoral torsion usually resolve spontaneously. Refer if there's persistence at the age of 8, the patient is symptomatic, there's asymmetry, limp, or associated deformities.
Created using Powtoon.